Hi, welcome to Santa Paula Hospital, a campus of Ventura County Medical Center, often known as the Hospital on the Hill. We're going to get a chance today to tour some of the great features of Santa Paula Hospital and meet some of our terrific doctors. Many of you know the history of Santa Paula Hospital. It was one of only 2 hospitals in the state of California to be supported solely by funds from the community. The hospital fell into hard times a few years ago, and thanks to the support of the Ventura County Board of Supervisors and CEO, we were able to reopen the hospital in 2006. The hospital now offers a broad spectrum of clinical care, and we're going to get a chance today to meet some of the folks who offer that care. Come with me on a tour. One of our many outstanding services at Santa Paula Hospital is our orthopedics department. Dr. Andre Zimmerman is our own community orthopedist, and he's here in his clinic today. Hey, Dr. Zimmerman. Good morning. How are you doing? I'm doing well, thanks. Good morning to you. I brought some folks in here and was wondering if you could share with us a little bit about the orthopedics department here at Santa Paula Hospital.
Yeah, definitely. Orthopedics department here at Santa Paula is on a daily basis, and we take care of all sorts of orthopedic injuries, from fractures to sports injuries and replacement surgery.
And you see patients here at the hospital and another clinic as well?
Yeah, I'm here 2 days a week in Santa Paula and 2 days a week in Fillmore.
And what kinds of injuries do you see?
All types of injuries, all types of broken bones, all sorts of sports-related injuries. Anyone basically with any sort of pain from either arthritis or any other chronic conditions, we basically see all sorts of orthopedic injuries.
And some of those patients end up in the operating room. Where do you do those surgeries?
All the surgeries are performed here at Santa Paula, which makes it nice. So you're seen here in the clinic and then have surgery here. And this hospital is a great place to have a surgery performed. Everyone from top to bottom gives great care. I think it's a wonderful place to have surgery performed.
And that's what I've heard from the folks in the operating room, that you're extraordinarily talented in scoping joints. Is the equipment out at Santa Paula Hospital state-of-the-art equipment for scopes?
Yes, I mean, it's the same equipment that I used during my training, so I'm very familiar with it, and we can do all procedures here, which is nice. We're set up to take care of anything that may walk through the door. We have a really nice setup here. I mean, the emergency room takes care of all types of injuries in patients. I think the quality of care and the timing of the care is excellent.
What a terrific resource for Santa Clara Valley to be able to have a fellowship-trained, highly skilled surgeon in orthopedics to be caring for the patients right here in your home. I really appreciate the time, Dr. Zimmerman, and it's a pleasure. Thank you for letting me interrupt your visit. Take care.
In terms of orthopedic surgery referrals, if someone comes into my office with a broken arm or other type of fracture that needs immediate evaluation, it's much more efficient and much more convenient for the patients to be able to refer them directly up to the hospital for evaluation and treatment.
We're so fortunate to have Dr. Zimmerman here with us. Now let's take a look at the lab. Hi, Shar. Sorry to interrupt you, but I brought some folks by on a tour of the hospital. This is Shar, our lab supervisor. And I was wondering if you could tell us some of the services that the lab offers here at Santa Paula Hospital.
Sure, I'd love to. Our laboratory has outpatient services where we have a phlebotomist that draws blood. We also get work from our clinics and physicians' offices. And our lab has a hematology department where we perform complete blood counts and urinalysis and coagulation studies. We also have a blood bank where we type the patient and get blood ready for patients who need transfusion. And we have a chemistry department where we run all kinds of laboratory tests like glucose and lipid studies.
And the services that you provide are for both the patients here in the hospital and patients in the community clinics?
Yes, we have many outpatients that come in, and lots of blood comes in from our clinics and physicians' offices.
That's terrific. What a great community resource to have a lab like that here at Santa Paula. Next, we're going to get a chance to see the radiology department where we perform CT scans, MRIs. We actually have an interventional radiologist here who can do interventional procedures. Let me introduce you to Dr. Chespak. Thanks for taking time with us today. We're taking a tour of the hospital, some of the different services here out at Santa Paula Hospital, and I Was wondering if you could share with us some of the radiology services that are available out here.
Santa Paula Hospital right now has pretty much all of the major modalities covered. Everything is state of the art. Interesting thing here is now we don't even use x-ray film anymore. Everything we use is recorded on a computer, and that also helps with our diagnosis, because we can take images and we can process the images, and we don't have to reshoot as many images. We results in a lot less radiation to the patient. We do plain x-rays. We do mammography. In fact, we have state-of-the-art digital mammography here at this facility.
What is digital mammography?
Digital mammography has been around for about 5 or 6 years now, and it allows us to take mammograms without using X-ray film. We still use X-rays, but it allows us to take the mammograms, and we have less of a redo rate. And what that means is we can take an image and say it doesn't come out quite right. We can post-process it with the computer, and that can keep us from having to reshoot the mammogram and to expose the patient's breast to more radiation. It's our goal to use as little radiation as possible in doing the imaging.
And what other kinds of modalities do you all offer out here?
We have state-of-the-art CT, which is CAT scan. We can usually accommodate patients on the same day. We have a very fast CAT scanner. In addition to just the CAT scan images which we require, we also have a very expensive and elaborate computer which can take those images and can add color to them, can create a 3D rendering, so that if you had an orthopedic surgeon that needs to know how the bones are aligned in a certain way, you can come to us, we can get those images. We also have state-of-the-art MRI. We have fluoroscopy, and we have actually 2 ultrasound units, and it's the same thing. We can usually accommodate patients the same day. We handle all of our emergencies, and we call back or send faxes of the results. And all of our doctors are connected through our PACS system.
And any doctor can refer patients here into the hospital?
Any doctor can refer patients here, and when I see the name of a doctor that I may not recognize, we get in touch with them, because we can allow those doctors to have access to our computer system, and they can actually look at the images in their office.
I utilize the X-ray department extensively. Dr. Chespak is wonderful. I send patients every day for X-rays at Santa Paula Hospital. That is invaluable, having patients have the ability to get their X-rays here in town. Oftentimes, when it's an emergency situation, I'll write a note on the X-ray order form, and Dr. Chespak can get me a result within an hour, and that is invaluable. We have a very busy practice, and without having X-ray close, it would be very difficult to continue to take good care of patients.
Now, I'm told that a hospital this size, it's very unusual for someone to have an interventional radiologist here, and I know that you've completed an interventional radiology fellowship, and can you describe a little bit about the extra services that we're able to provide because we have an interventional radiologist?
Because of the leadership and the quality of the medical staff, I was interested in coming here and developing some of the interventional radiology procedures that they do elsewhere in the nation. I actually trained up in San Francisco and practiced in the San Fernando Valley for 15 years, and saw the need here. Let's say you're an older lady with osteoporosis and a compression fracture. I can take you into the operating room using our specialized X-ray equipment. I could put cement into these vertebral bodies, and the pain disappears almost immediately. I can open up arteries. One of the things I have particular expertise in is placing small particles into the arteries that supply the uterus. We do a lot of pain management here at Santa Paula, a lot of procedures. It's interesting to me just how many people walk around out there with chronic pain. I can not all the time, but I can make that pain go away almost within 5 minutes. And sometimes it comes back, but sometimes it doesn't. And we can follow you here at Santa Paula with MRIs to look for herniations of your lumbar spine and your back pain and other joints too. So
And I can attest to your expertise, having suffered from sciatica and gone through multiple treatments, seen multiple doctors, and then physical therapy, and then came out to visit you for an interventional procedure, which was very, very remarkably successful for sciatica for me.
I'm glad it helped.
And Larry, we're just so fortunate to have you here in Santa Paula Hospital. I really am glad to have the chance to share with the community the resource that's here at Santa Paula Hospital and you and the department that you've created here. And we look forward to working with you for many years to come.
Well, thanks for your support.
Take care, Larry. So you can see the state-of-the-art radiology and interventional radiology services that we have here at Santa Paula Hospital. Another huge resource for the community is our emergency room. And I think people who saw the emergency room closed during that 3-year period can appreciate that having an active open emergency room in a community like this truly saves lives. Let's go ahead and take a look at the emergency room. I am here with some friends who are touring the hospital. Could you let me into the emergency room? Thanks. Hi, Dr. Levitt. How are you doing?
I'm good. I'm good.
Excellent, excellent. This is Dr. Noah Levitt, one of our ER physicians, and Dr. Levitt, we're on a tour here of the hospital, taking a look at various departments, and certainly the emergency department is one of the most important departments here at the hospital. What does it mean to a community to have an open ER here in their town?
It's definitely important to the community here. You know, we have a busy, well-equipped emergency department here, and we see a wide variety of patients. We're able to treat a wide variety of conditions. You know, people come here from Santa Paula and the surrounding community, and they're appreciative of having an emergency department that's up and functioning here locally. If there is a need for a higher level of care, we're closely associated and affiliated with the Ventura County Medical Center. We have consultation with them.
And a little earlier today, we saw AMR drive one of their ambulance back up to the ambulance bay. Do you get many patients here at Santa Paula Hospital by ambulance?
We do. We get high volumes by ambulance. We get, you know, a good volume of patients that come by private auto, and we have patients that walk up the hill and come by when they have, you know, need to be seen by a doctor here.
What other kinds of specialists are available to help you out with patients here at Santa Paula Hospital?
We do. We get a share of critical patients that require emergency surgery. We have capabilities here to do appendectomies, cholecystectomies, emergency abdominal surgery. We have OB/GYN.
And of course, the ER doctor is here all day, every day?
24/7, yeah.
That's terrific. Well, we certainly heard a lot of feedback from the community about how important it is and how much they missed having an emergency room during the time that the hospital was closed. So what a terrific thing to be able to offer to the community here, to have an ER doctor right here in the...
Having Santa Paula Hospital locally made a great difference to my patients as well as the healthcare community in general. When Santa Paula Hospital closed about 5 or 6 years ago, my patients had to go to Ventura for their emergency care as well as elective surgeries. And that travel time, the difference of 15 to 25 minutes from Piru, Fillmore, Santa Paula, was a critical difference for some of the patients. Now that the hospital's been reopened, I can see that they can get emergency care when they need it.
So we're so proud of our emergency care here at Santa Paula Hospital. We've had multiple community members remind us of how important it is to have an open emergency room at Santa Paula.
Hi, Dr. Frank.
Hey, Bea, how are you doing?
Doing well.
Good,
Doing
good.
well.
This is Bea Frias, our hospital nurse manager, and Bea, we're taking a tour of the hospital. We've seen several areas, and we're wondering if you could tell us a little bit about the ICU.
I'd love to. We're very proud of our ICU, and it'll be a real privilege. We have 6 ICU beds fully equipped to take care of critical cardiac patients and ventilator patients. As you can see, Dr. Samuel Edwards was a physician who has supported Santa Paula Hospital throughout the years, is a pillar of our community, and was instrumental actually in creating the vision for our 6-bed ICU.
One of the things Dr. Edwards believed in was having all of the services here in the hospital, including ICU, OB, and surgery.
We have a fully functioning surgical suite. Why don't we go take a look at it?
Terrific, let's go. Hey, Dr. Lowe, how are you doing? Hey, good to see you. Good to see you. Hey, I brought some folks along with me on a tour of Santa Paula Hospital. This is Dr. Isaac Lowe, who's one of our general surgeons here. And we just thought maybe you could share with us a little bit about what kinds of surgeries are done here at Santa Paula Hospital.
Happy to. I'm one of the many surgeons that we have here. The main general surgeons that are here are Dr. Blickenstaff and myself. We operate 3 days a week. We have a wonderful group of orthopedists. We have ear, nose, and throat specialists that are here about every week. And of course we have a great obstetrician and gynecological team with Dr. Howe and a lot of the other family practice people that are helping out with her.
And I've heard from some of the folks here in the operating room that you're an exceptional laparoscopic surgeon. Maybe you could tell us a little bit about what laparoscopic surgery is all about.
Oh, they're very kind. And, we've got a great team that helps support us with the operating room nurses and the scrub techs. They're really great to work with. We're very fortunate that we have actually very good equipment here for the laparoscopic procedures.
And I know initially when the hospital opened up, there was one operating room running. Where are we at with that right now?
Well, we're up with 2 operating rooms that are going pretty much the entire week, every day of the week. And we're working on the 3rd.
And now, Dr. Lowe, I know you've been in the county here for many years and had practiced in Camarillo for a good long time and have moved over to be a full-time Santa Clara Valley surgeon. Are there other full-time Santa Paula surgeons?
Yes, I think Dr. Blickenstaff has been doing the bulk of the work, and he was the pioneer that helped keep our operating room staffed 24/7 since it reopened in 2006. And I was happy to join him and hopefully take some of the load off his plate for about a year and a half now.
And now, I know as we talk to people in the community, several of them had said that they wanted to have their surgery up here at Santa Paula Hospital. Are people able to be referred up to your clinic so that you can operate on them here? And if so, how would they do that?
Absolutely. We have clinics here. I'm here 3 days a week. Dr. Blickenstaff's here a day a week. All you have to do is call the Santa Paula Hospital Clinic system and they can make an appointment.
We sure are fortunate to have you here, Dr. Lowe. I've heard exceptional things about your skills in the operating room, and we are so fortunate to have a full-time Santa Clara Valley surgeon here at the hospital. Thank you so much for taking the time to share with us about the surgical suite and the surgical services here, and we look forward to continuing to work with you. Thank you so much.
My pleasure. Thank you very much. Thanks for coming.
Oh, Dr. Fankhauser, by the way, want to mention that we have this beautiful new physical therapy department that we've recently expanded, and it's located at 570 West Main Street in Santa Paula. Let's go take a look.
Hi, I'm Carla. Welcome to the Santa Paula Outpatient Physical Therapy office. It's actually more than just physical therapy. We have occupational therapy too. This is our gym area where we do our treatments. We have high-low tables for patients when we're doing manual therapy. We have different types of equipment for cardiovascular training, balance training, strength training. Because we get a variety of patients, we get neurologic, orthopedic, general types of medical patients. We have hand therapy patients. Different occupational therapy patients would also be receiving services, whether if they've had strokes or head injuries and different things that affect their daily activity function. Physical therapy, we tend to work with obviously restoring function from a walking standpoint, use of the arms, legs to do work-related activities and household activities, addressing pain issues, maximizing function. If you come on over here, these are some of our bikes. We have 4 or 5 bikes. We have a recumbent bike for individuals who don't tolerate the upright bike well. We have parallel bars for those individuals who need the extra support for standing and balance activities for safety. You'll see a myriad of equipment here that is a variety of tools that we use from a manual standpoint, also for mobilization activities, canes for balance and walking, stair steps and things to work on balance and stability. We come down in here, this area is just more of our equipment. We have a very nice newer treadmill that can work in forward and reverse. We have a performance trainer that allows patients to work hydraulically. Another piece of equipment that is really useful for us is this total gym, and it is great for patients who are not fully weight-bearing. It allows us to adjust their weight-bearing status while they're recovering, especially from leg injuries, but it's also used for upper body strengthening as well. Thanks for taking a tour with me here at the Santa Paula Outpatient Physical Therapy Center. I hope you enjoyed it and it was helpful, and we look forward to seeing you again.
So I've heard so many terrific stories about deliveries at Santa Paula Hospital. It seems like a very peaceful and enjoyable place to deliver baby.
Wonderful environment to be in.
Hey Lisa, how are you doing?
How are you doing? Dr. Fankhauser, B, how's it going? Good to see you. B, how's it going?
Good.
Thanks for coming to the OB department and visiting us here.
Thank you. Will you be so kind as to show us one of your labor rooms?
Absolutely.
We've heard so much nice things from the community about deliveries here at Santa Paula Hospital. And just wondering, Dr. Salinas, if you could share with us a little bit about what makes deliveries here special and unique.
Well, I can tell you that when we are trying to convince somebody to have their baby here, we bring them down and show them the labor suites, and they're sold because they see how nice and ample the space is, and they get private rooms, and they get sort of the calm atmosphere, the one-on-one nursing, and the beautiful view out the window, and they're sold. They say no more. I want to have my baby here. So it's really, yeah. I think, you know, the space sells itself, and then the fact that we have a staff that's competent and caring and friendly. They are always willing to show people the labor suites, and so I think people are, you know, we don't have to say very much. We just bring them down here, and they're really impressed usually.
That's terrific. And
Yeah.
do you find that families are part of the deliveries as well out at Santa Paula Hospital?
Oh, absolutely. We try to include whoever, you know, we have a talk with patients about it ahead of time, and we, you know, let them know that we just want, whoever's there, we want them to be there as a support person. We don't put limits on it as long as they're there to help. We love having them, and that's part of what makes us so special, is that we really do have that kind of, yes, you know, we want this to be your experience. We're not here to tell you how to do this.
We sure have heard wonderful things about you and the deliveries that you do out here.
Well,
I
thank
know
you.
you have a lot of support staff in breastfeeding education. How are things at Santa Paula Hospital?
Well, we have a full-time breastfeeding consultant. All our nurses are trained in consulting patients and we strongly encourage all our patients to breastfeed. If we're having difficulty, we get our breastfeeding consultant down here right away and help her, you know, help the new mother get the baby to latch on, and really spend a fair amount of time with that particular thing. Yeah.
That's terrific. And I know you have a terrific track record of being able to deliver babies vaginally. I see the cesarean section rate here at Santa Paula Hospital is exceptionally low. What happens if a patient does need a C-section?
Well, we have a absolutely amazing surgical staff here. I would choose to be here if I were a patient. Both because of our anesthesia staff, who are absolutely excellent, and our OR staff, who are just amazing and really, really supportive. So we actually do, I think, a top-notch job. The occasional patient who really needs to be sent to VCMC for whatever reason because they're higher risk, we also have really good services in terms of transport, you know, and we even have the neonatologists who can come here, and if we have a baby who needs that expertise of a specialist, we have them right pretty much down the street in Ventura, and they're over here in about 20 minutes.
That's terrific.
Yeah.
Well, it's a beautiful setting, a calm setting, and beautiful surroundings here with a highly competent staff. It's no wonder that more and more people are delivering here at Santa Paula Hospital.
Yeah, no kidding. I would do it if I were at that point in my life, for sure.
That's terrific.
Yeah.
Thanks so much, Dr.
You're
Sewell,
very,
for
very
taking
welcome.
time to show
Anytime,
us around
yeah,
here.
anytime, come on by and we'll be happy to show you around.
Terrific. And of course, we rely on a terrific group of volunteers, not only to meet folks at the door, but also to sew blankets for the newborn children and sew toys for our pediatrics. They help us out at the health fair, and they've put together this beautiful gift shop for our patient visitors. Well, that concludes this tour of Santa Paula Hospital. We sure have enjoyed having you here and appreciate the chance to show you what resources are available here. When you do have a healthcare need, we hope that you think of Santa Paula Hospital, the hospital on the hill.